There are different sizes available, slightly different shapes. You see this shape? It's slightly smaller. Okay, this one is even smaller. You can use it for small teeth. You can use it for children deciduous teeth as well. Okay, you see the dent, the width, it's different. Okay, see, there is a difference in width.
Medium.
Okay, and you see there are 1, 2, 3, 4. 1, 2, 3, 4. These are the indentations in which it goes and engage here. So if you engage towards the proximal, your band will be smaller. The same as we unscrew this and make it smaller. So it's the same. Okay. These are all premolar bands. Okay, or deciduous molar bands. Then there are bigger as well, dimension wise. Like for example, this one. You see, it's significantly bigger than the rest of these.
The small one is for deciduous.
Usually for deciduous teeth, yes. They are all used for posterior teeth. Now see this one? It's way bigger than these. So these are used for permanent molars most of the time. Okay. Another thing, if you are looking at it, there is this one. There is a small curvature. What is the importance of this curvature? You see this curvature?
Close the space maybe.
Which place? Which space?
For proximal.
Proximal, it is been covered by this wall, the hole. If you do it like that,
Gingival maybe.
the gingival portion will be covered with this. Okay? When you place it, sometimes what happens that the buccal and lingual embrasures the band will stuck in the buccal and lingual embrasure. But sometimes the gingival floor is way down than the embrasures. So there is no way you can push a straight strip subgingivally. So here, what is the advantage of this? Even if the buccal and lingual embrasures has been stopped by this portion will go further, deeper, and cover the gingival margin. If you do not cover the gingival margin, what will happen? That even if you placed a wedge, when you condense the amalgam in this area, there will always be a space, and the amalgam will move on beyond the gingival, the matrix band, and create an overhang. Okay, so this overhang has been avoided by this. So in this case, we will be using a molar band in order to finish the preparation, restoration of amalgam. So you place these again. So selection of a matrix band is important. You should know which matrix band is used for which. Okay, and the same retainer will be used for every kind of matrix band, even deciduous, premolars, molars. Okay. Usually, the second or the third, these two holes are used most of the time for almost every tooth. Okay. For premolars, the second one, and for the molars, third one is used. Okay. The other important thing is that you have to keep this surface towards the occlusal. It should not be like that. This would be considered as upside down and a mistake. Okay, so it has to be like this. And when you are placing this, the correct placement is the gingival marker. It should always face the gingiva. You should not place it like that. That will be considered incorrect.
What's the benefit?
The benefit is, again, the gingival portion, it will go into the gingiva. That's the benefit. Okay. So we will push the hole into the matrix band. Okay. It will go with a little slight push so that it stays there. So if I place it in a second hole, it's going to be a slight smaller. So that is why I'm placing it in a third hole. Okay.
Second for premolar.
Second is usually for premolar because premolar is has a small diameter. So that is why we are not using it in the. Yes. Now, so this is how the direction of the jaw will be. So we cannot place it like that. You see, you cannot place it like that. So what will you do? You will see how can you place it. If you make it like that, upside down, this is the proper way. But what is the problem here? If you place it like that, the gingival portion is coming up. Okay, so you have to keep this in mind so that it goes down. Okay, so what will you do? You will open it up, you will remove it
Make it opposite.
and make it opposite. Yes. So this is the point that I want to emphasize on it so that you don't do the mistake this time while using this. On the distal side, the same position is okay. Okay, now you place it like that, slide it down, okay, it goes subgingivally, and you hold it with your finger, stabilize it, and then okay, now you see this. If I place it like this, did you find the claws where it's coming? The claws are coming a little.
It's very, very small.
It's small. It's small. So what is the what can be done? What can we do
Make
in
it
order
in
to
the
correct
last
this? Make
last
it in
hole.
the last hole. Okay, so we place it in here, in the last one. These strips are smaller. So we'll use the last hole in order to gain access. We put it here. So like this. Now it is going into the gingival embrasure. We will secure it tight here. Okay,
Stable now.
it is stable. It's gone subgingival. Now if you see, without a wedge, you can find out, you see, it is stabilized, it goes subgingivally, but you can see the gingiva from above.
Yes.
Okay, if you keep it like that and restore it, what will happen? This space will be occupied by the amalgam filling, and when you take an X-ray, there will be a big overhang. Okay, in order to avoid this, we use wedge. Give me the. You don't have the
Yeah, there.
tweezer? Tweezer? Can I have it? The wedge, you all know, it's a triangular shape. So the base of the triangle should face the gingiva, the apex should face the occlusal. Okay, it should not be upside down. So this is how we use it. You can place it from the buccal side, from the lingual, whichever is feasible, okay, in the patient cavity, oral cavity.
This wedge is very big.
Yes,
It's not gonna go in.
you have to see this. But the advantage of wooden wedges is that you can modify them. Okay. Now, if you see the same tooth with the wedge, now see that
Yes.
pink portion is gone.
Yeah.
I'm afraid if we remove the wedge, the amalgam will go with it because it's too narrow.
No, amalgam. Between the amalgam and the wedge, there is a band. Okay, so the band is touching the amalgam, not the wedge. So if you remove the wedge, it should ideally do not harm the amalgam restoration. Okay. Now after placing this, now this is the position. You see the matrix band, it's medially. Okay, this portion is up, the claws are engaged in the embrasures. Okay, the matrix band is covering the position where you want it to be, and the wedge is covering the gingival portion. So all are correct. You double check it, everything is okay, and then you can start and ask your assistant to prepare the amalgam, and he will prepare the amalgam and he will start restoring. Okay, do we have amalgam gun? Okay, amalgam gun, carrier, and first step is to place it in the deepest part. So which one is the deepest part in the cavity?
Proximal.
The proximal part. So we place it in the proximal part and we will condense it. You have to condense it firmly so that it reaches to every part of the cavity.
Should be faster, yeah.
Yes. You have to give an ample amount of condensation forces, okay, so that it reaches to every part. Sometimes some of the voids are there. When you remove the matrix band, those voids will jeopardize the filling. Again, place it there, slightly press it, and then again. Okay, overfilling would be important. Yes, you have to do the overfilling initially. There is one step which I forgot to tell you is before placing the matrix band, it's better to burnish the band initially, as you see in the
Yes.
okay. For burnishing, we need to have a pad, a mixing pad, and this burnisher. This
What's
is
the
a
point
small
of it?
one. The burnishing of the band will help you create the contact in a better way. Okay, it will give it a slight curvature, and that curvature will ultimately create a much better contact point rather than placing a straight matrix band. You see? When you find it sufficient, the proximal part, then you can continue it into the occlusal portion. Okay. This is a spherical amalgam alloy. In spherical amalgam alloy, even if your condenser is not reaching to the depth of the cavity, it will still not be a problem. Okay. When you press it from the up, as these are spherical, they are balls, so they will slide and reach to that area. Okay. Previously, the lathe cut alloy, you need very bigger cavities, because if you do not press it into line angles and point angles, it will not reach there. But with advancements in the amalgam restoration material itself, this doesn't seem to be a problem. Now it is slightly overfilled, okay, but I will still place a little more if we have here. And we will compress it more so that to make sure that every nook and corner of the cavity will be filled, yes. Now you see, it's a lot of restorative material is present. Almost all the occlusal surface is covered. That is okay, and that's better. Okay. So after this, usually the examiners or the teachers will tell you to ask the patient to just place a cotton on top of it and let the patient wait for a few minutes so that it settles down. Okay, that's another way. That's one way to approach. And some examiners will tell you, okay, there is no time for this. You can start removing some of the amalgam and then removing the wedge and the. So both ways are correct. Okay, for me, I usually prefer start removing the amalgam ASAP. Okay, usually students are in the fear that at this time, when you remove the wedge and the matrix band, it will break. This is not the case, and I have seen some students while removing the matrix band, it breaks away. It is because of not for the removal of the matrix, when it because of the condensation, if you do not condense it well, it will break anyway. Okay, so first we will do margination. Margination is the removal of the amalgam between the filling and the matrix. Okay, you will remove all the extra from the buccal lingual area. You know which area is being prepared for cavity and which is not. So we'll remove all from those areas where the cavity is not there. Okay, you will clear it up all in the patient mouth. Remove slightly from here again. You see if any extra is there. Okay, some from the marginal ridge. The marginal ridge is very important in a class 2 cavity. If you reproduce a proper marginal ridge, your life will be very easy. If you don't prepare it, then ultimately what will happen, your amalgam will set up, it will be fixed, and you will not be able to, you will not be having much time for this to carve it.
Doctor, in a patient mouth, how do we take this all debris?
You can place a cotton on the distal surface at the throat, one, but the important point is that if you place a rubber dam, then it's not a problem.
So
You will
just
use it with the...
take the rubber dam and take everything.
Yes,
with
you
it.
can use suction as well. Now, first, usually what the people do is they remove the wedge first. Do not remove the wedge first. First try to remove the retainer, as we do for the
We don't have to burnish first.
we can do burnishing, but first just slightly open it up. Okay, the debris will be gone. We don't have a bigger burnish. We'll do a pre-carve burnishing so that everything sets up in different areas. The other advantage of this pre-carve burnishing is that all the extra will also be removed along with that. So here, if you see the amalgam, it's starting to set very quickly, so you don't have time for this, for delays and ask the patient to wait for 5 minutes or no. You don't have time for these things. So you will remove you will open the matrix, and since okay. This is the one thing I hate about these retainers, is that once they go inside, it stuck there. Okay, you remove this, then you remove the wedge slowly, keeping the band steady with your hands. Okay, and okay, you have to use both your hands and slightly jiggle it up, and it should not be removed occlusally. Okay, either you have to remove it buccally or lingually, from here or from here. Okay, like this. Okay, now you can see it's overfilled. The proximal part is already, there are no voids and everything. We will use the marginal trimmer, this one, the carver. Remove the extra, starting with the proximal part. Yes. Okay, if you find anything extra here, you can carve it with the carver. You can use the perio probe as well. You will start to remove the extra. If you look, I am not starting from the occlusal surface, because I would just want to remove extra from the proximal first, because it's going to be the
contact area.
not the contact area is done, it's there now. When you remove the wedge and the matrix band, your contact area is reproduced. The marginal ridge is important, so you have to prepare the margin. Starting from the marginal ridge, you come to the proximal, follow the contours, You see, all these are just extra. We're trying to remove it. You see the direction of the blade?
Yeah.
It should be
Going with the cusp, right?
angulated, yes. It will follow the cusp.
So this is squeezing sound, right?
This is the creaking sound, yes. So it means that the amalgam is already starting to, yes. So you will be having very less time for this. So I'm always using the angulated direction. I'm not using like this.
So you don't
It will not
overcut.
work. Yes. No, if you the advantage of using an angulated blade is when you are creating the fissures, it will automatically create the inclined planes, and this is what we want actually. First, check the height. You have to the height should be yes same. Otherwise, it will feel higher. We don't want to keep it higher. Correct the height first and then create the anatomical fissures and grooves. Your blade should follow the contours of no, that's going to be very strong. Don't. So it is covering both the tooth and the restoration at the same time. The blade of the carver is contacting both the filling material as well as the original tooth structure. So there will be no ditches. Okay. Now if you have if you see there is the shape of the cavity has evolved. Okay, you have removed all the extra. Now you will do some kind of a little finishing. You see, if I left this in the patient mouth for 5 minutes, I'm already done with the. You cannot then. Even at this time it is harder to carve it. You see, it's very.
Already over.
It's very, yes. It's already harder. But
So this is higher, I think. Higher than the green one.
no, it's okay. Not higher. It's okay now. This inclined plane is a bit higher, so we'll try to remove it. Okay. And then we will do the postcard burnishing. and you can do some modifications accordingly. That's why it's already set. Okay, so the margin ridge is okay, it's not high. Now the fissures are okay, the inclined planes are okay. You can check finally with the help of the patient using an articulating paper whether there are any small areas which seems higher or not. Okay, and the rest is just fine. So this is how you restore a class 2 cavity. The most important step is to place the matrix band and place a wedge. And then when you condense all the amalgam, how to remove the matrix band and the wedge step by step. It's very important. If you do mistakes there, then your filling will be cracked or something like that. Always check the margin, proximal margin areas with the help of a probe to see whether is there any overhang or not. Okay, it's very important to check the overhang. You can see the overhang. Is there any? It should be flushed with the gingival floor.
Check it also.
Contact area is already reproduced. You can check from the proximal.
Yeah, very good.
Okay. You can do the same now.
Thanks, doctor.
لازم نجهز كيف كده يعني